Hi, everyone. I'm Kara Sundlin, and welcome to Facebook Live. If you're looking for a job out there and you're passionate about mental health, this is for you. So if you're a therapist looking for a new job, there are immediate openings on CHR's Assertive Community Treatment Team, ACTT. We're going to talk about what that is, but it's really a wonderful opportunity, really, to provide intensive, life-changing care to individuals with great need. Joining me now is Laura O'Neill. She is the Clinical Program Director for ACTT, and Stacey Helms, Senior Talent Acquisition Specialist. Ladies, thank you for being with us.
Nice to meet with you.
So I want to start with you. Let me start with whoever is best to answer this question. What is Assertive Community Treatment Team, or ACTT?
I'm happy to answer that. So the Assertive Community Treatment Team is an evidence-based model and practice that provides assertive and intensive care, really wraparound support to engage individuals with serious and persistent mental health experience into very personalized, recovery-focused treatment and rehabilitation. It's a long-term treatment, so it's not time limited. And it's with a multidisciplinary team of providers, which includes a nurse, an embedded prescriber, which is really unique, therapists, recovery support specialists, and more. And to break down barriers, the care is provided in the community. So that might be in a public setting. It might also be in the person's home environment through a very highly individualized, person-centered approach that provides adults with the kinds of tools that they need to obtain and maintain safe housing, for instance, employment, to fulfill their roles and their relationships, and to find relief from symptoms and medication side effects.
Yeah, okay, so, I mean, that's a lot, but I wonder if people are listening right now, who would be the best suited for that? Like, what types of people could benefit, or how do you apply for that?
To access the Assertive Community Treatment Team at CHR, you would come to our triage center and present for an open access appointment. You would receive an intake with one of our intake clinicians who would really evaluate whether you would be appropriate for that kind of service.
Okay.
Typically, folks who come to ACT have been experiencing several crises in their lives. They may have been in and out of the hospital. They may have been really struggling to access care, or have struggled to engage in care in a traditional sense in an office-based setting.
Okay. And so where are these ACT teams based? Because I know you guys serve a lot of different communities.
We certainly do. So CHR runs two ACT teams. There's one in Manchester and there's one in Enfield, and there are openings for therapists in both programs.
All right, so Stacey, I'm going to guess this, as a talent acquisition specialist, this next question would probably be for you. What are the benefits for therapists who would work for ACT at CHR?
Well, there are many great things about being a therapist for ACT, and especially at CHR. It's not a desk job. You work in the community side by side with the individuals that these clinicians serve. This also translates to more flexibility in your schedule each week. ACT's an intense program, so rather than 1 hour every week or every other week, you spend a total of 6 hours per week with clients. This allows you to really dive deep and help people learn to avoid behaviors or patterns or behaviors that ensnared them in the past. ACT is an evidence-based model with a proven track record as therapists. They do see remarkable changes in the lives of the individuals in the programs, including improvement with their relationships, families, housing situations, employment, and more.
Yeah, I mean, and that must be really fulfilling for a therapist to be able to witness the change and see really that the program is helping.
Absolutely.
Yeah. And let's talk about CHR. It's been around. We've done many stories with you guys. What really is the CHR difference?
CHR is really committed to social change and helping and empowering people with mental health experience so that they can lead healthy and fulfilling lives of quality. And CHR encourages mentoring, professional development, education, and really provides therapists with opportunities to work closely with senior leaders in the field And I think best of all, we are encouraged to be creative and innovative, and that really makes us clinicians rather than technicians.
Mm-hmm. And if people are listening, and I know you really need help, the good thing about the pandemic, we're all talking about mental health more, but there's a lot of demand. And this sounds like a program I know that's evidence-based and helping a lot of folks. But what types of qualifications are you looking for in a therapist?
Someone coming to the ACT team would need to have a master's in a relevant field, whether that be social work or licensed professional counseling. And they would at least need to have a preliminary licensure. So someone, for instance, who is MSW certified, they would need to have at least their LMSW in order to join the ACT team.
Okay, okay. And for someone who might be looking for a new career, can we talk about, Stacy, I'm guessing this is for you, what types of things does CHR offer for employees?
Absolutely. Well, we think CHR is a great place to work. CHR has repeatedly been named a top workplace year after year based on anonymous data gathered through surveys. For the last several years, CHR has been the top ranking human service provider and has received special recognition for providing excellent training programs and work-life balance. If you are out there and you're looking for a rewarding career with meaningful work, here are a few things to know about CHR. We do offer competitive salaries and excellent benefit packages, potential for sign-on bonuses, pay differential for bilingual staff, scholarship opportunities, continuing education and leadership training, loan repayment options at select sites, and vast career growth and development among CHR's more than 90 behavioral health programs.
And are you all looking to hire immediately? Are these jobs that people can have right now, provided they're qualified?
Yes.
Absolutely. We actually will be having an in-person all open position job fair at our Windsor location in January. So stay tuned for more details on that to come.
Okay. But again, people can go right now and apply. This is something that there's a great need, and you would like people to apply as soon as possible if they're interested?
Yes, absolutely. They can go on our website, www.chrhealth.org/careers, and they can view all open positions, specifically our ACT programs.
Okay. And again, I'll just repeat that. We encourage everyone who's watching on Facebook, feel free to ask some questions in the comments below. I know CHR, you guys can go back and look and maybe answer them. And we'll make sure that you have the website again at chrhealth.org/careers. You can look again. This is the ACT program, the Assertive Community Treatment Team, or ACTT. Though, again, I know you've got other positions open as well, but specifically, if you're interested in part of the ACT team, they'd love to hear from you. Again, the phone number to call is 1-877-884-3571, 1-877-884-3571. Lastly, a lot of people have been asking this. Can they work remotely? I know you mentioned there's a flexible schedule. Do you need to be close to these locations, or sometimes you could be remote?
Stacy, do you want to clarify, or would you like me to?
I think it's probably most appropriate for you. Yeah, you know the in and outs of the ACT program best.
Sure. So the assertive community treatment model does not allow for remote work. This is an intensive service, and we are face-to-face with people. So no working from home can really occur.
Okay.
When we're providing these services.
Right. And again, you mentioned, for those who are just joining the feed, this is a special evidence-based model where it is a little more intense. You're getting to spend like 6 hours a week with your client and really get to see things change. And you've got a couple different locations. If you want to let everyone just know, again, the best places for therapists who might be listening, the areas where you're really looking for therapists for this program.
Sure. The Assertive Community Treatment Team exists in both Manchester and Enfield.
Manchester and Enfield. So hopefully you might be closer to one of those. And you're looking in both locations. Is that correct?
Yes.
All right. Well, ladies, thank you so much. And we want to encourage everyone to, share this in their feeds. Mental health is so important, and I know you're trying to do great work, and you just need more folks because there's quite a demand out there. So we appreciate you coming here to get the word out to help more people.
Thank you very much for your time.
Thank you both.
Thank you.
Thank you both. And for more information, again, visit chrhealth.org/careers, or you can give them a call. The number's there on your screen, 1-877-844-3571. And thank you for being here, everyone. Share this in your feeds.
Bye.
Do you guys still hear me?